Okay, this is the fourth section of the critical care station of abdominal aortic aneurysm. Okay, and we finished hypothermia, which is included inside this station in the MRCS part B, and we are working now in the blood transfusion. Okay, so I'm Dr. Azia, and we are going to continue in the questions that will show up to you in the exam. You will be asked other 2 or 3 questions about transfusion or blood or hematology in general, and they are going to tell you that this patient's hemoglobin is low and his platelets are low, and his PT and PTT, which are related to the coagulation factors which are in the plasma, are disturbed. So what are you going to do here? And your answer should be, I'm going to give whole blood. This is the best answer now. Okay, before you are going to give 1 packed RBCs for hemoglobin plus 1 platelets, 1 pack of platelets plus 1 fresh frozen plasma, right? But it will be better for you to give whole blood now. Okay, well, so let us go to another question here. What are they going to ask you else? They may ask you another question, and some questions may look stupid, you know, but they are testing your basic knowledge. You are under tension, and if you are under tension, you will make mistakes. Okay, so they are going to ask you in a packed RBCs bag or glass, one packed RBCs. Okay, what are the clotting factors which are involved in that packed RBCs bag? Okay, in that RBCs bag, how many clotting factors, or what are the clotting factors are there? And actually they are nil. Okay, because your packed RBCs come after removing the fresh frozen plasma, and in the fresh frozen plasma all the coagulation factors are there, right? So nothing remaining here. Okay, so you want to say that there are no coagulation factors there, or if they ask you that what clotting factors are stored stored blood products deficient in, you are going to say all of them. They are not there. Okay, well, this is an easy question with good marks for you. They are going to ask you now about what they call how can you reduce the use of blood products? You know that blood transfusion has many complications. How can you reduce the use of blood transfusion or blood products? Okay, so there are many things that you can do. But by the way, most of the people or most of the surgeons or the doctors go to the blood transfusion. But you want to tell that. Number 1, you are going to use some expanders. And expanders are usually divided into 2 categories. The first category is crystalloids. It is water and crystalloids are water and salt, or water and sugar, or whatever. The second type is colloids, like starches and these things. Okay, this is the first way. Fine, you can give albumin. This is a colloid also. Anyway, crystalloids and colloids. You want to expand the circulation with something other than blood. Okay, good. What is the second way to do that? The second way to do that, you can use something called cell saver, or they call it blood salvage. Okay, blood salvage. So you are saving the blood of the patient in a certain way and returning it back to the patient. Okay, So in this way, you will not need to, because this is the patient's blood, so no reaction will occur there. Okay. In this way also, there is something called acute normovolemic hemodilution. This technique is called ANH, acute normovolemic hemodilution, ANH. Okay, and this technique is done by the anesthetist. Okay, and it is same to that one which we mentioned about cell saver. Okay, so in this case here only this blood is diluted and then returned back to the circulation. Okay, another way to that you do not want to use blood products, external blood products we mean here, is that there is something called hypotensive anesthesia. Okay, and hypotensive anesthesia reduces the bleeding. Patient is hypotensive, so there is no high pressure to do the to cause bleeding, because to have bleeding you need a pressure gradient between the vessels and between outside. So outside, suppose that there is no pressure, inside high pressure of the patient, so there will be huge bleeding. They are using this sometimes. It has some complications, but it is a technique that can be used, if not widely now, but maybe in the future. Okay. The last way which we can remember here is that you can use something called hypothermic technique. Okay, and in hypothermic technique you are reducing the basal metabolic rate. So the oxygen consumption is low, the temperature production is low, heart rate is low, everything is low, so you will not need a lot of oxygen for the processes, for the biological processes. Okay, but you do not want the patient to be hypothermic, because you know the complications before. So these are some of the solutions that you want to give. These are solutions, suggestions for if you do not want to use blood. By the way, if you need at the end, most of the people will use blood products or blood. Okay. They are going to ask you another question, and this question actually will be concluded so shortly because of time. You have very short time in the station. So they are going to ask you about what is the mechanism, how hemostasis occurs. What is the mechanism of hemostasis? Hemostasis, not homeostasis, okay? Hemostasis. How the blood stops, bleeding stops. This is the question. Okay, so you want to mention that there will be, number one, vasoconstriction, first step, without details. Okay, no time. Number two, there will be a platelet, primary platelet plug that will form in the beginning to stop the bleeding. Number three, there will be coagulation, blood coagulation, okay, to form the final plug there. Okay, and fibrinogen is confirmed to fibrin and these things. Okay, number four, there will be something called clot retraction. Okay, and finally there will be, we want to put it somewhere here, five, something called fibrinolysis, and this will lyse the clot. Okay, this will lyse the clot. So first step, vasoconstriction after the injury, then after that there will be a primary blood by the platelets, after that there will be coagulation, after that there will be clot retraction, and the last step is fibrinolysis to resolve the clot. Okay, these are the steps. Finished. Okay, so they may ask you another question: what polymerizes or what polymerizes fibrin? Okay, so fibrin is polymerized by thrombin. You know that from the coagulation cascades. Okay, these are simple questions that you are going to mention here. These are all the questions that may show to you in the examination. They may ask you about how the vascular surgery interferes with the mechanisms of hemostasis. You know that the vascular surgeons usually give this, especially like in this patient of abdominal aortic aneurysm. This operation is done by a vascular surgeon. So they give many things to stop the to reduce. They reduce the pressure. They give many things that will, they injure the endothelium. They give many things to keep the blood running because they are defecting the mechanism of coagulation. But if this question shows you can just fantasize and you will find the answer in the other, from the other answers that I mentioned before. But it is not a common question, okay? So here we can stop and this part of hematological or blood transfusion in this station has finished, and they are now going to ask you about the abdominal aortic aneurysm itself at the end. You want to be ready for that, so let me give you some ideal answers that you can use there. Okay, thank you.